Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss medical terminology, anatomical position, anatomical plane, and term of the location. At first, anatomical position. In anatomical position, body is erect in position, face directed forward, feet is directed forward, slightly apart, palm of the hand is facing forward, thumb is away from the body or directed laterally. The importance of the knowledge of anatomical position. It provides a standard position for describing body parts, ensure clear and accurate communication among healthcare profession. This is chest X-ray and it is marked by the right side and left side is marked in chest X-ray. But without your marking, you can easily identify the right side and left side of the chest X-ray by using your anatomical position knowledge. This is the apex of the heart is directed downward, forward and to the left. So this is apex, this is directed toward the left side. So this is the left side of the chest X-ray, this is the right side of the chest X-ray. The knowledge of the anatomical position also help in identifying and explaining location and relationship of the body structure. By anatomical position, we know this is the right lateral surface of the liver. It is situated in the right side of the body, and according to the description, we know the right lobe is higher than the left lobe and right lobe is bigger in size. So this right lateral surface is divided into three parts: upper one-third, middle one-third, lower one-third. Upper one-third is related with lungs and pleura, middle one-third only pleura, and lower one-third only the diaphragm. So for liver biopsy, we choose the middle third to avoid injury the lung tissue. So the knowledge of the anatomical position is help us clinically. The knowledge of the anatomical position uses terms like anterior, posterior, medial, lateral based on this position. We hold, this is the anatomical position of the urinary bladder. After holding like this position, we explain its external features. This is superior surface, this is posterior border, this is lateral border, this is anterior border, this is inferior lateral surface. So to describe the different external features of the any organ, we need to know the knowledge of the anatomical position. In many clinical procedure, we actually choose a safe place um, which to do this procedure without any unnecessary injury of other structure. So knowledge of the anatomical position is help us in this situation. This is the chest X-ray. This is apex directed downward, forward and to the left. This is the chest X-ray. You see the apex is directed downward, forward and to the right. In the marking, this is the left side, but apex is not in the on the left side of the picture. So this is the normal heart. Apex is directed toward the left side, and this is the altered position of the heart. This clinical condition known as the dextrocardia. So this is the normal position of the apex of the heart. This is the apex of the heart in dextrocardia. Now proximal and distal. This term is frequently used in many situations to describe a particular body location, in case joint, in case the origin insertion of a muscle. So the proximal always the point which is nearer to the trunk. This portion is trunk. So any point nearer to the trunk is known as the proximal. And this is distal. This is away from the trunk. Superficial and deep. Superficial near the surfaces of the body, and you cannot say the superficial means superior, you cannot say it is anterior, it cannot say inferior. So it is the superficial which is near the surface of the body. This is the perineum. Here the superficial means inferior and deep means superior. In case feet also, superficial means inferior and deep means superior. Now middle or median, superior and inferior. If we divide any structure like this through a horizontal plane, cut by a horizontal plane, the above portion is superior, lower portion inferior. This is median plane or middle portion of any structure, and there is 2 points. The point nearer to the median plane is medial. The point away from the median plane is lateral. So this portion is known as the median. You can say middle, you can say midline. So any point nearer to the median plane, medial, this is lateral. If there is a three portion, what you say? You say this is medial near the median plane, this is intermediate, and this is lateral. This is medial cuneiform, this is intermediate cuneiform, and this is lateral cuneiform. Superior surface, anterior surface, posterior surface, inferior surface. This is the vertebral body. It has superior surface, inferior surface, anterior surface, posterior surface, and lateral surface. This is anterior border. This is anterior superior surface, posterior superior surface, posterior inferior surface, and anterior inferior surface. This is the pancreas. This is the body of the pancreas. See, this is anterior border, this is anterior superior surface, and this is anterior inferior surface, and in this picture not showing, in the back side, posterior surface. This is the viscera of the urinary bladder. You see, this is the superior surface, this is inferior lateral surface, and this is anterior border. Little bit complicated. What is this? Superior surface, anterior superior surface. What is this? Anterior inferior surface. What is this? This is inferior surface. What is this? Posterior inferior surface. What is this? Posterior superior surface. Anterior border, posterior border. In embryology, the directional term is little bit confusing. For example, this point, cranial. Anything towards the brain is known as the cranial. This is caudal or tail end. This is ventral surface. This is dorsal or back surface. In case brain, this term is little bit confusing. Dorsal means toward the top of the head and the back of the spinal cord. Ventral means bottom of the brain, and in case spinal cord, front of the spinal cord. Rostral means toward the front of the brain and or the top of the spinal cord. Caudal means toward the back of the brain and to the bottom of the spinal cord. Now, anatomical planes. Two vertical plane, coronal plane, sagittal plane, horizontal plane, and odd or angle plane or oblique plane. This is coronal plane. It divides the body into anterior and posterior part. Most of the time, this division is not equal. This is horizontal plane. It divides the body into upper half and lower half. This is sagittal plane. It cuts the body into right half and left half. So this is the coronal or frontal plane, and you see how brain is look like after cutting. This is coronal plane, how foot is cut in coronal plane. One half contains toes, another half is devoid of toes. This is the head, this is the coronal plane, cut the body into anterior half and posterior half. This is median or mid-sagittal plane, or some books also known as the sagittal plane. It divides the body into right side and left side. After cutting, brain is look like this. Horizontal plane. It separates the body into upper half and lower half, and see how the cut surface is look like. Parasagittal plane. Any plane parallel to the median plane or mid-sagittal plane divide the body into unequal right half and left half. To understand this plane, also helpful to understand slide of the histology. This is a tubular structure, the seminiferous tubule, the slide of the testis. Within the slide, within the testis, there is a tube is present known as the seminiferous tubule. Actually, this tube look like this. In cross section of the testis, this tube is cut in different plane. It may cut longitudinally, so it look like this, look like this. It may cut obliquely, so it look like this. It may cut like this, so it look like this. So it is very important to understand the different planes of the body to understand the section of the histology structure. This is what type of section? Horizontal section. This is coronal section. This is sagittal section. This is sagittal section. This is coronal section. This is transverse section. Liver, kidney. Vertebra posteriorly in front, liver. Liver above, kidney below. Vertebra in the middle portion. Coronal section, sagittal section, transverse section. MRI scan, horizontal section, coronal section, sagittal section. Term of position, median. Medians mean midlines, imaginary vertical line down to the middle of the body. Medial, any point toward the median plane. Lateral, any point away from the median plane. This is median umbilical ligament. This is medial umbilical ligament. This is lateral umbilical ligament. You get more information from Handbook of Medical Terminology, and understanding medical terminology is crucial for beginner in health profession This book simplify medical terminology with clear explanations and focus on basis. Enhance your medical language skill with this practical guide. For this book, email me. This is my email address. So this is all about today's video. If you like this video, please like the video, share this video, support my channel by subscribing, and thank you for watching.